Do we have to start over from the beginning for YouTube?
No, you don't. It's on
Did it really
CT.
happen?
It's recording on CTN, so I think we should be fine.
Thank
And
you.
we're-
Administrator. Is there any suggestions about a consent calendar? Okay. Could you go be a little faster, Representative Carpino? I believe we're ready for Representative Kennedy.
Thank you, Mr. Chairman. I'm sorry for that late hand. I just have one clarification. So you had said that documentation or the documents won't be shared, but what's the difference between shared and access? Because various authorities do have access to it. I know they sign confidentiality agreements and et cetera, but see what I'm getting at? I'm just,
Yeah,
it's a play on words, I'm sure, but I just, if you could clarify, sir, I'd appreciate it. Thank
I'm
you.
not sure I can make a huge distinction between access and shared because only certain parties, providers and the like would even have access. I think the bigger point, however, is even when they are accessing the data, they're not accessing individual data. They are able to access statistics that relate to the data and relate to their particular reason for having the data. The only distinction I would say is in the case of some providers, it's important for them to have validation that somebody's vaccinated for their purposes. But that again is a relationship between the provider and the patient in that instance.
Okay, thank you. I appreciate that clarification.
Representative Carpino, I think.
Thank you, sir. I do have a question. Based on language of 457, to follow up on Representative Kennedy's question, I just want to be clear that there's no identifying information at all, because there seems to be some. Is there absolutely no identifying information in here? Because the way I'm reading some of this language makes me think perhaps otherwise.
I'll try to be as clear as I can. My understanding is when it comes to the health districts and a number of parties who have access, there is clearly no individualized or personally identifiable information. But I have to make the distinction between that and what a provider may require in order to take care of a patient, which will clearly have to be individualized. But again, we have laws on the books that affect the provider-patient relationship where the patient has to provide permission for that.
And thank you for that clarification, because when I was looking at lines 17 through 19, it specifically identifies a vaccine recipient. I'm actually voting no for a number of reasons on here. I believe in vaccines. I got both of my children vaccinated, but I took the time to go through the opt-out provision for CT Wiz. And having gone through that as an individual, a standard constituent going through the process, I didn't find it as simple as it could be. And I really do believe it should be an opt-out. We're talking about adult information. And I'm not convinced that the urgent care walk-in center that I utilize because I cut myself and I might need an antibiotic needs to know my entire vaccine history. It might not be my standard provider. And this is about privacy. I think it is a great option. And again, I'm talking about adults. I think this is a wonderful option, but I do believe that this is one for adults. This should be an opt-out. I don't believe that that is a giant undertaking. If we're educating folks already with the opt-in, it could simply tell them how to, I'm sorry, with the opt-out, it could simply be altered to say opt-in. And in the world of personal privacy, and with so much data being kept online, this is not something I can support. But thank you, sir, for the clarification.
I understand your position. I will vow to make sure that DPH is aware of some of the challenges of opting out via CTUS. Perhaps they can improve upon that. Representative Betts, followed by Representative Zupkis for the second time.
Yes, thank you, Mr. Chairman. I have a question. Why was it decided to do opt-out in this bill as opposed to opt-in? Because the opt-in seems to me as if it would be requiring parents and everybody to want to participate in the program. For those who don't or who are skeptical about how that information is going to be used, albeit you've said repeatedly that it's not going to be used personally, that's putting a lot of faith in government, very frankly. And the idea that a lot of people have accessibility is very unsettling. So I think one of the ways to at least improve this bill is to take out the opt-out and insert opt-in. So again, my question is, why was it started with opt-out? To you, Mr. Chairman.
We start by saying, Representative, that you are government. So we only create the trust that we deserve. And I think we all have an obligation to establish trust in authorities and particularly in government. To answer your question directly, you can understand that if it is our desire to collect as comprehensive data as we can, so we can really do the kind of deep dive analysis that will allow us to identify healthcare issues across the state, having more data accomplishes that objective. And opt out, bless you, promotes the collection of more data than an opt-in does. And that is why we are biased on the side of an opt-out. Representative, does that answer your question?
Yes, I respectfully disagree with that. And, as far as my being government, I think it's also knowing that we have to represent our constituents since we're in government to make sure their interests reflect what they need as well as what the state government needs. But I feel pretty strongly about having opt-in versus opt-out. So we'll just have to agree to disagree. And I thank you very much.
Thank you. And I take your point. We're all here to represent our constituents and do the best we can with what we know. Representative Zupkis for the second time.
Thank you, Mr. Chair. If this bill was opt-in, I would support it because I do understand the importance of collecting data and information, but I think that should be the choice of parents and guardians of children and of themselves. It's my responsibility to do that. So I 100% understand. Again, I would support it if it was an opt-in versus an opt-out. The other concern that I have is I have constituents that came to me and said their children are not vaccinated, especially with COVID, when some of this was all happening. And we sat through hours and hours on vaccine bills, and they have trouble already getting some physicians to see their kids or pediatricians. And I am really concerned that if and I understand providers seeing it in all the information, but if my child goes to a different pediatrician, or if I go to a different primary care, they can automatically look in and see what vaccines I have and don't have, and my children or whoever. And that is, in my opinion, going to curtail some of the services that people are already struggling to get. So that is another concern that I have. Thank you.
Thank you, Representative. Indeed, the whole subject of vaccines can spill over into a lot of other considerations. Representative Pettit.
Thank you, Mr. Chair. When constituents have reached out, most have been opposed to this, and I realize that is likely an ascertainment bias, and the people who are opposed are going to reach out, and the people that don't care one way or another or agree are unlikely to reach out. However, having said that, with my own healthcare providers, they have their own system and are keeping track of my vaccine data, and that's another way for the state to look at this data. I understand the possibilities of collating the data on a statewide basis from a public health perspective, but at the moment, I won't support this, and perhaps we can make some changes that make it a little more palatable to our constituents and reassure people about personal privacy, though I agree that Commissioner Giuttani did answer my questions very directly on privacy and the who the information was available to. But I think I will flag this with a no and see if we can make any further changes. Thank you, Mr. Chair.
Thank you, Representative. And thank you for bringing up the point that there are a number of places where we collect data. But I, for one, am incredibly frustrated about the challenges we face in this state to bring it all together in one place so we can do that kind of analysis. You would have thought with the billions the federal government has spent on electronic medical records and all this technology, we would have single sources for this. And yet we struggle to put together data in a way that we can help people. And that's what this bill is intended to do. Any other comments or questions? If not, Madam Administrator, we're ready for a roll call.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar, Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Burgess Givallo,
Representative Berger Gervallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Representative Green, I did not see you on screen, please.
Representative Green votes yes.
Thank you. Senator Haskell, Representative Cavus DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Clarides DeTrio,
Representative Claire DeStitria votes no.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Anwar,
Senator Anwar votes yes.
Senator Wong, Senator Summers,
Senator Summers votes no.
Representative Dauphiné, Senator Haskell, Representative Ryan, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, we're holding the votes open to 11 o'clock this morning. I've been advised, before we move on to item 8, I've been advised that since we removed item 2 from the consent calendar, we should square that away with a roll call vote before moving on. To refresh everybody's memory, that is item 2 is Senate Bill 371, an act allowing infection prevention and control specialists to provide services. Whenever the administrator is ready, we can do a roll call vote on that bill.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes. Senator Anwar votes yes.
Thank you. Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Gervallo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep Foster votes yes.
Representative Django,
Representative Django votes yes.
Representative Green,
Senator Green votes yes.
Senator Haskell, Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Dietrich,
Representative Claire DeStitria votes yes.
Representative Lenahan,
Representative Linehan votes no.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Representative Betts, Representative Dauphiné, Senator Haskell,
Senator Haskell votes yes.
thank you. Senator Moore,
Senator Moore votes yes.
Representative Ryan, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Once again, the votes will be held open till 11. We now move on to item 8 on today's agenda. Item 8 is House Bill 5484, an act concerning the Department of Public Health's recommendations regarding private and semi-public well testing. This is a JF. Do I have a motion? Moved by
So
Representative
moved.
Pettit, seconded by
Second.
Senator Anwar. Thank you. Representative Young was the one who moved it. I misheard the voice. Thank you, Representative Young. Okay, this bill requires, as of October of this year, that a property owner to test the well quality of a private or semi-public well prior to selling, transferring, or exchanging the property. Testing must be completed at least 45 days before the transaction, and the prospective buyer must pay for the cost of the test. The buyer pays. Under the bill, the lab that conducts the test must report the results within 30 days, so it's available before the closing, obviously, to the DPH and the local health department where the property is located. And it also requires that owners of newly constructed private or semi-public wells test the well's water quality. And of course, to be specific, the bill tests for coliform, nitrate, nitrite, sodium chloride, iron, manganese, hardness, turbidity, the pH, sulfate, apparent color, odor, lead, arsenic, and uranium. Yes, indeed, there's even uranium, normally occurring radioactive material. The intent of this bill is to assure particularly homeowners or people intending to buy homes that they are aware of their water quality or any issues relating to it. Are there any questions or comments with regard to this bill? Representative Foster, followed by Representative Berger-Truvalo.
I am grateful for the opportunity to speak on this bill. I think that we're hearing from the community that there might be some concerns for sales of home related to this specific policy. And I, for one, don't feel like having a contaminated well should negatively impact sales of home. We have lots of examples in our community where people have homes that are that there is a viable solution to managing their contamination, and it negatively impacting their home sales would be problematic. Simultaneously, though, we have people whose road salt contamination in their private wells is gradually escalating over time. And had they known earlier of a problem, they could have started the multi-month and multi-year advocacy process to, for example, get hooked up to Connecticut water, if that's an option in where they are, or some other way that they could address road salt contamination. And these folks are already having a problem selling their homes. They're already having a negative impact in their sales. So I am really curious if advocates have opportunities to protect public health by encouraging more regular testing of private wells in a way that is sustainable and cost effective, but also find a way to protect homeowners. As I started sharing earlier, I have a constituent who is mixing baby formula with well water that was contaminated with road salt, which is not toxic, but ill-advised to provide to an infant. And I think that there's lots of examples of people testing their wells and having no reason to suspect that there is anything dangerous in their well. They're testing it for other reasons and then are finding that there has been something they and their family and their pets have been consuming for a long amount of time. So I feel really strongly that this bill should get out of committee and that it can be something we can work on to make it effective for all of the parties that are interested. But as the Public Health Committee, I think really prioritizing safe drinking water is such a critical component to public health. And I think that there's ways to make sure that we are advocating for homeowners and sellers and buyers simultaneously to protecting public health interests. And I'm eager to help figure out what that solution is, and we'll vote this bill favorably out of committee today.
Thank you, Representative. I think you make some important points. Our job here in the Public Health Committee is to, where we can, protect the public health, but by no means do we intend to inhibit or interfere with the sale of homes. We just think that at least periodically, people ought to know what are in those wells, because if you don't sell your home for 30 years, you could have a growing problem and not even be aware of it. There are those who would argue that we should be requiring testing more frequently than just on the sale of the home. But this is where we're going to start. Representative Berger-Truvalo, followed by Representative Claridis Ditria.
Thank you, Mr. Chair. I will not waste everyone's time by saying much of what Rep. Foster said, because ditto. But I will also express that within my own community, which is a community that is a very heavy New York City what's the word I'm looking for? They moved to me from New York City. Many people, their first experience with well living is in my community. And they have been very surprised to see not only the degradation that existed within the systems in the house, but then also accompanying health problems. And so while I also agree that we must do something about this, I'm also willing to work with the advocates to try and come to a solution that will work, because certainly we don't want to damage home sales, but obviously public health is paramount here. So thank you very much, Mr. Chair.
Thank you, Representative. Representative Claridis Ditria, followed by Representative Everybody should be muted on Zoom.
Okay.
Please proceed, Representative. Oh, we had it from. Okay, just to remind everybody, we are participating via Zoom. You must be muted on Zoom. Thank you. We are still not there. Okay, let's give it a try, Representative Claire DeStitria. Madam Administrator, can we mute everybody and then start over again? All right, let's give it a try.
All right, thank you.
Try this microphone.
I'm sorry.
Test. Okay, here we go. It was me. Sorry. It was me. It was me. I was on mute. I wasn't using the microphone. So, all right. My fault. I apologize. All right. We all have these issues. All right. So my question through all this is, if someone tests their well and it comes up with elevated levels of whatever, what's the process after that? Is that the decision of the buyer and the seller? Through you, Mr. Chair.
We do not get involved with what might transpire between buyer and seller should a problem be identified.
So that will be their decision. It doesn't go to any agency or the reports. It's just, it gets tested, it comes up with whatever levels, and then the buyer and seller decide what they choose to do to mitigate after that.
I am not in the real estate business. I understand sometimes when things are discovered prior to closing that may lead to an accommodation on the price, but I'm in no position to suggest that that would be the outcome. It just would likely be in the interest of both buyer and seller to make sure that the issue with the well is remediated under somebody's efforts. You will note that it's the buyer who pays for the lab test, so that we're presuming it's the buyer who's going to be eager to learn whether or not that the well is totally safe from a quality standpoint.
Thank you, Mr. Chair. Sorry, everybody, for the problem.
Okay, at least we know where it was. Representative Zupkis.
Thank you, Mr. Chair. And actually, to the point you just said, that it goes between the buyer and the seller, that's my whole point. I come from, in my town, almost everybody has a well. And when you sell a house, that is part of the negotiations. You have it checked. If it's bad, then you negotiate, and they decide if it's coming off the price or who's paying for it, whatever. I don't believe it's government's place to be in between the buyer and the seller. I understand clean water, but that's up to the realtors, the people that are purchasing or selling the house. So I am a no on this today. Thank you.
Thank you, Representative. I respectfully disagree that all we're doing is requiring information be provided.
But we are requiring the buyer to pay for it. And there's the process, we're requiring this, and then it's hands off and we're letting you deal with it. So why wouldn't we just do that in the first place? So thank you. I appreciate your comments, but again, I will be a no. Thank you.
If the representative wants to make this even stronger, we can contemplate that as well. Representative Kennedy.
Thank you, Mr. Chairman. Mr. Chairman, I just want to echo the comments of my colleagues. This is the health and safety of our children, our families, certainly is paramount. But I do believe this is a bit of an overreach. Having grown up with a well, it's not easy when you live on well water, but we always did our due diligence. And I know when my parents sold their home, they had it done themselves for the buyer. So at that time they did it. They were the seller. So it makes sense, but unfortunately it doesn't make sense, this bill, to me. I just want to just say that I just think it needs more work. I'm sorry. I just think it needs more work, and I don't think it's ready to come out of committee the way it is right now. So unfortunately today I'm going to be a no. Thank you, Mr. Chairman.
We hear you, Representative. We are eager and willing to discuss it further should it make it out of committee. Again, it's not our goal to create problems in the sale of a home other than to make sure we're protecting everyone's public health when and where we can. Representative McCarty.
Yeah, thank you very much, Mr. Chair. And just like to add my comments that while I think it's very important that we have good well water and that we test properly for all of the contaminants. So I'm very much in favor of that for the public safety purpose. But where I'm disappointed is, and I've received information, the Connecticut realtors were trying to work with DPH to get this in a good position going forward. And so they're requesting that they have the opportunity to continue to work on this bill, excuse me, so that we can all be very supportive. So today I will be flagging it with the hope that we get the language in the right order so that it can be a yes. Thank you, Mr. Chair.
Thank you. And again, we are eager to work with Connecticut's realtors and DPH to see if we can find some accommodation. But that is presumably we get this bill out of committee in the first place. Next up is Representative Kavros DeGraw, followed by Senator Summers.
Thank you, Mr. Chair. And I would say I'm going to be a yes on this bill, hoping that we do improve the bill. But I would also say that for towns that have a mixture of well and town water, it really is a challenge because there's not that sort of built-in, well, we all know we have wells and we're going to negotiate this well during the sale of a home. I think that, when you consider the housing market that we're in right now and how tight it is in terms of selling a home, buying a home, when they're saying you don't even have to fix anything in your home to be able to sell it, there are a lot of unintended consequences of these these sales happening so fast. I don't want to call them quick sales because that's a different kind of sale, but I think that for this, it really is important because it can be, an expensive process for the person who bought it, who maybe was just able to get into that house. And I just know as someone who once bought a house with some very unintended consequences after the fact, it would be better to know a lot of these things up front. So I'm a yes today, and hopefully we can work with the realtors and DPH to improve it.
Thank you, Representative. Yes, we're eager to make it as reasonable as possible. And once again, we are not in any way involving ourselves in the sale of a home. We are simply making sure that certain critical information is available to the buyer. Senator Summers.
Yes, I'm going back and forth on this particular bill. I just wanted to share, I have experienced buying a house in a foreclosure and the realtor saying, these are things that you should look for. Make sure that you get the well tested. We do have a town that has both public water and many are on wells. We had the well tested. It was contaminated with lead. And we were able to negotiate, getting a new well drilled, et cetera. So I think that's part of the due diligence on the buyer and the seller's point is to make sure and ensure that they have a well that is properly working and it is not contaminated, et cetera. I think it's important that we work with the Department of Public Health, but the realtors, they're the experts. They're the ones that are on the front lines of the housing market and dealing with the people buying and selling. And I think this bill needs more work. I don't want to add more to the plate and require somebody who is purchasing a house spending more money to have something tested. I think that maybe we should work and find out if we can include this in a disclosure, et cetera, like we do for, lead paint in the house. So I'm going to be a no today to flag this, to see if we can come to a better understanding between the Realtors Association and DPH and ourselves. I'm disappointed that the Realtor Association was not able to have their voice clearly heard by DPH. And I just wanted to make that clear that that's why I will be a no today. Thank you.
Thank you, Senator. Representative Pettit, followed by Senator Haskell.
Thank you, Mr. Chair. I guess to be brief, I would echo Senator Summers' comments. I think we all heard the same testimony, and some of the folks representing the realtors thought that the timing was poor, but I didn't hear a suggestion of a different time. Unless I'm miscalculating, I suspect this bill will move out of committee. I'll be a no today and hope that we can work out the language because I think the testing is critical, although there's obviously a responsibility on the buyer seller to approach this and
Have to say no.
so thank you for the time, Mr. Chair.
Thank you, Representative. Senator Haskell.
Thank you so much, Mr. Chair, and I'll be very brief because I know time is limited today. I just wanted to say that I've enjoyed working in the past with the realtors on legislation, and so I took time last night to read over their testimony. And as I recall, it was their testimony that this is sort of a best practice. I believe the realtor who spoke with our committee in the course of the public hearing mentioned that he actually strongly recommends this in all transactions in which he's involved. That's all the more reason to say that we ought to enact this into law, because I think that there are a lot of good actors and experienced realtors who do require this, but perhaps not all. And we want to make sure that that best practice is implemented across the state so that no buyer gets left behind. I appreciate the comments of my good colleagues with regard to questions that buyers should be asking, but with all due respect, I think that there are a lot of first-time home buyers out there who don't know to ask those questions in the first place. And that's why I think we need to pass this bill, and I'll be voting yes today. Thank you, Mr. Chair.
Thank you, Senator. Excellent point. Most of us only end up buying a home 1, 2, 3, 4 times in our entire lives, knowing exactly what to do, particularly if you've come from an urban to a more suburban or rural environment. You have a lot on your mind just getting to closing. And this provides them with information that may give them peace of mind that they're making a good purchase. Seeing no other comments or questions, Madam Administrator, we're ready for a vote.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell, Representative Cabris DeGraw,
Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Claritas Detrier,
Representative Claritas Detrier votes no.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarty,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Representative Betts, Representative Elliott, Senator Haskell, Thank you, Mr. Chair.
Thank you, Madam Administrator. We're holding the votes up until 11 o'clock, which is fast approaching. We will now move to item 7 on today's agenda. Item 7 is House Bill 5480, an act concerning the accessibility of mental health services. This is a JF. Do I have a motion? Moved by Representative Gilchrist, seconded by Representative doesn't matter. Representative Zupkis. Okay, this is a very straightforward bill. It allows students enrolled in a psychology doctorate program at an in-state higher education institution to provide professional psychological services in person or through telehealth while under the supervision of a licensed psychologist. The goal is to do what we do for certain other specialty areas, to provide practitioners who are in the process of earning their degree to get important clinical experience, and equally importantly, providing some additional access to psychological services given the great need in the state. Again, the important point here is even while they are pursuing their degree, they must do this work under the supervision of a licensed psychologist. Are there comments or questions? Representative Linehan.
Thank you very much, Mr. Chairman. I absolutely support this bill. And I just wanted to make a quick comment, however, that a provision very similar to this is in House Bill 5001, which will also be voted on by this committee. And the additional provision in that bill adds a little extra benefit to kids in the state, and that they will also be able to practice under DCF in their new psychiatric walk-in centers. So that's something that's really important. And I just want to also mention, in case anyone is concerned, this is also something that we do with licensed clinical social workers. And so I absolutely support it. I just wanted everyone to know that this will also be in 5001 that we vote on hopefully soon. So thank you very much, Mr. Chairman.
Thank you, Representative. Yes, we will be dealing with House Bill 5001 on Friday. So probably start your reading now because this is an extensive bill. I will also say that 5001 is a particularly important bill this session because it focuses on children's mental health, but actually covers other mental health issues as well as workforce issues. There are also a number of other bills, including SB2 and others, that touch on many of the same issues. And it's our responsibility after these bills pass out of committee to reconcile them, to make sure they work well together, there's no redundancy, and they're consistent. That job is still ahead of us, but we'd like to get this bill out of committee so that we can get to that point. Representative Pettit.
Mr. Chair, I ask that we place this on the consent calendar, please.
Thank you. I'd forgotten about that consent calendar. I haven't used it in a while. Are there any objections? If not, we will add this to the consent calendar. The last item we will discuss from scratch is item 3 on today's agenda, Senate Bill 451, an act establishing a working group to study the expansion of mental health resources to children. This is a JF. Do I have a motion? Moved by Representative Pettit, seconded by?
So moved.
This is definitely Representative Kennedy this time. It's not Representative whatever. Okay. Moved and seconded. All right, just to clarify, this bill is very straightforward. It establishes a working group to study and make recommendations on methods to expand the availability and provision of mental health resources to children in the state. The group's membership includes 3 appointed members, the member from DCF, from DEMAS, from DPH, or their designees, and the chairpersons and ranking members of the children's and public health committees, and then they must report back their findings and recommendations by next January in time for the next session. You know, we have got a lot going on with mental health services, and particularly for children. This group is going to provide some oversight and to make sure we're on the right path, and ideally investing our resources and supporting those who provide these services appropriately. Senator Anwar, followed by Representative Linehan. Senator Anwar.
Thank you, Mr. Chair. I have a feeling that Representative Lanahan is going to say what I was going to say, that I think this concept is already in SB2 as well as I think 5001, but there's a little bit of a difference because we are looking at a cabinet to assess collaboration between the various agencies, but we also have an advisory group looking at that which is in existence, and we are trying to expand that. So while this bill is an important one, it is well recognized by anybody who's dealing with the children's behavioral and mental health challenges that we need something like this. So I will be supporting this bill, but I just want people to know and be aware that this is already in one of the other aircraft carriers. Thank you so much, Mr. Chair.
Thank you, Senator. Representative Linehan.
Thank you, Mr. Chairman. And yes, I'd like to align my thoughts with my co-chair in Children, Senator Anwar. And I'd also like to thank Senator Kelly, who has really been an incredible ranking member on the Children's Committee and is really committed to children's mental health, and it shows. And so while yes, certain iterations will be in 1, 2, 3, maybe 12 other bills, it is very important, and I do hope that everybody supports it. Committee, we will be seeing our larger. And so thank you very much, Mr. Chairman.
Kind of missed the last part, Representative.
Ditto. Just go with ditto from what Saud said.
Okay, thank you for that. I will just add that the number of bills we have before us this session that relate to mental health is no accident. We all observed what transpired during the pandemic, particularly with our children, but we knew these problems pre-existed the pandemic, and that only became exacerbated during that time. We, because of our budget issues, have really shredded the public healthcare safety net in many ways. And this is maybe not in and of itself going to take care of the problem, but it's a marker. We're putting down a marker that we are very serious about dealing with these issues. And this is clearly not only a bipartisan, but a nonpartisan issue. All the caucuses in this legislature are absolutely committed and dedicated to doing something significant. The governor is as well. We're going to ideally devote some significant state funds and some federal pass-through funds to this task. And I just want to thank everyone who's been involved, not only in 5001 and SB2, but in any number of ways to be part of the solution here. And again, thanking Senator Kelly for his dedication and hard work on this subject. If there are no other comments, I believe, Madam Administrator, unless Representative Pettit wants to say. Representative Pettit?
Sorry, Mr. Chair, did we add this to the consent calendar?
We could. It's a thought.
So
Just put it out
moved.
there.
So moved, Mr. Chair.
Is there anybody who objects to putting this on the consent calendar? If not, I believe we're ready for the consent calendar. Madam Administrator, I believe we have 3 items on the consent calendar. If you could just confirm those 3 bills.
Item number 3 on the agenda, Senate Bill 451. Item number 5, Senate Bill 456. And item number 7, House Bill 5480.
Thank you. That conforms with my understanding. I believe we're ready for a vote on the consent calendar.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Janga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell.
Senator Haskell votes yes.
I did not see you on screen, please.
Haskell votes yes.
Thank you. Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarice Dietrich,
Representative Claire DeStitria votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon,
Representative Scanlon votes yes.
Representative Tersiak,
Representative Tersiak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong, Representative Betts, Representative Dauphiné, Representative Elliott, Representative Ryan.
Representative Ryan votes yes.
Thank you, Mr. Chair.
Thank you, Madam Administrator. That concludes today's JFing of bills. Again, we are continuing to keep the votes open for another 24 minutes. So all of those of you who have not voted because you were in transit, snap to it. And we are in recess until 11 o'clock. Thank you. We'll see you all on Friday at 12:30 for another round of passing bills.
Representative Scanlon.
Hi, Bev.
Hi, how are you?
I'm okay.
You missed the vote on item number 1.
That's the vaping bill.
Yes,
I vote aye.
thank you. Item number 2, infection prevention control specialist.
Aye.
Item number 4,
Aye.
item number 6,
Aye.
and item number 8.
Aye.
Okay, thank you.
Thank you.
Representative Ryan,
Representative Ryan votes aye on all the bills I missed. They're the same as Scanlon's. I just followed down the list.
Thank you, sir.
Thank you.
Who's next in line, please?
Hi, Beverly. I just signed in. I'm not sure if I'm next or not.
There's a bunch of us, so I may
Oh.
be early.
Okay.
Take
any of us.
I only had two, I think, that I missed.
Travis DeGraw, you missed item number 1, Senate Bill 367.
Campers DeGraw votes yes.
And you miss item number 4, Senate Bill 454.
Campers DeGraw votes yes.
Thank you.
Thank you.
Let's see if there's another
Hi,
one.
hi, Bev. It's Michelle. I don't know if I missed any. I just wanted to make sure before I logged off.
No, please do not log off yet. Thank you.
Okay.
I think you're all set, Representative Cabras DeGraw. Let me see. Burgess Javali, you're next in line. Let me see. You missed item number 1.
Burger Javala votes yes on 1.
You missed item number 4.
Burger Javala votes yes on 4.
Did I get you on consent? I think I did.
I think you did. Didn't I miss 3 of them? I feel like I missed 3 in the car. Am I wrong?
Nope.
Okay.
You're all
Thank you very much, Beverly.
You're welcome. Senator Summers?
Yes, I just wanted, I think I missed a couple because my internet connection is tricky.
You missed item number 4.
Can you tell me what the title is on that one? I'm
An act
sorry.
concerning DPH's recommendations regarding the Center for Disease Control and Prevention Youth
I'm a
Risk
yes, please.
Behavior Survey.
Is that all I missed?
Nope, let me check you before you go. And I have you on consent. You're all set. Thank you.
Thank you.
Rep. McCarthy?
Thank you so much, Beverly. Which number? I was caught downstairs in the basement for a half an hour today. The elevator wasn't
Number
working.
4.
Okay. Let me just look. I'd like to vote yes.
I think that's it.
Yes, thank you so much, Beverly. Thank you.
Representative Cook?
Yes, dear.
I'm looking to see what you missed. I have you on everything.
All right. Thank you.
You're welcome.
Have a great day, Bev.
Thank you, Representative Cook. Senator Kushner?
Yes.
You missed item number 4.
Senator Kushner votes yes.
You're all set.
Okay, thank you.
You're welcome. Senator Haskell?
Hi, Beverly. How are you? Sorry, I missed a few.
You missed item number 6.
I'd like to vote yes on item 6, please.
You missed item number 1.
Yes on item number 1 as well.
And you missed item number 8.
I'd like to vote yes on item 8.
Thank you.
Thank you so much.
You're welcome.
Beverly, did I miss anything? It's Senator Moore. Beverly?
Just a moment, Senator Moore.
Okay.
You missed number 1 and number 4.
Number 1.
Is a nicotine
Senator Moore
bill.
votes yes on number 1.
Thank you. And number 4.
Senator Moore votes yes on number 4.
Thank you. I think that's all you missed. That's all you missed.
Thank you.
You're welcome. Representative Elliott,
Good morning, Beverly.
how are you? Let me
Doing well,
start.
good to see you.
Oh, you missed most of them.
Hey.
I know you go between meetings, so that's okay.
All right, all right.
So 4, 8, and 6. So you're good on, you need to vote on consent first. And
I'm a yes. Okay.
Thank you. And then we have item number 1, that's the nicotine bill.
Yes. Rep. Elliott votes yes.
Item number 4, Senate Bill 454.
Rep. Elliott votes yes.
And item number 8.
Rep. Elliott votes yes.
Thank you very much.
Thank you. Have a good morning.
Same to you. Enjoy session.
Beverly. Beverly,
Yes, Henry. Give me 1 second. I'm losing
Sure.
my mind. Representative Dauphin, I'll be with you shortly.
okay.
Okay, Henry Jengo. 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 Henry, you're all set.
Beautiful. Thank you very much.
Okay, Representative Dauphin,
Hi,
As
Beverly.
always,
How
good
are
job.
you?
I'm well, thank you. Can we
I
vote?
apologize for the link. I get confused because I'm looking for your name and I don't see it. And then
That's okay.
thank you.
Let's vote on the consent calendar first. That is House Bill 451, 456. I'm sorry, Senate Bill 451, Senate Bill 456, and House Bill 5480.
Rep. Daphne votes yes.
And then we go to item number 1 on the agenda, Senate Bill 367.
Rep. Daphne votes no.
Item number 2 on the agenda,
Rep. Daphne votes no.
item number 4,
Is that 454? Still 454?
454, yes.
Rep. Daphne, no.
Item number 6, 457.
Rep. Daphne votes no.
And House Bill 5484.
Rep. Daphne votes no.
Thank you. You're all set.
Thank you so much, Beverly.
You're welcome. Senator Wong?
Thank you, Beverly. If you could take me through the list, that'd be great.
Okay, for consent, it is Senate Bill 451, item 3 on the agenda. Item 5 on the agenda, Senate Bill 456. And item 7 on the agenda, House Bill 5480.
Wong votes yes.
Thank you. Item number 1 on the agenda, Senate Bill 367.
Huang votes yes.
Item number 2 on the agenda, Senate Bill 371.
Huang votes yes.
Item number 4, Senate Bill 454.
Huang votes yes.
Item number 6 on the agenda, Senate Bill 457.
Huang votes no.
And item number 8, House Bill 5484.
Huang votes no.
Thank you very much. Have a good day and
Thank you.
enjoy
Thanks.
session.
Thank you, Beverly.
Bye-bye. John Michael Parker, are you there? Dallas?
Yep, I'm right here. I'm missing bets on 3 bills. I can text them now.
Yes. Can you text him, please?
Mhm.
And if you can't, if you don't get him, ask Dave Radcliffe to get him.
Okay.
Radcliffe has got a way of finding him.
Hey, Bev.
Yeah. Hi, Nick.
Hi. I may have missed it at the end. Did we unraise that bill?
Oh shit, he didn't announce it.
You recorded, Beverly.
Whoops. Let me find him, Nick.
Okay.
I'm so sorry. I was Nick. Hey, Nick?
Are we ready, Madam Administrator?
Yes, Mr. Chair.
Or we are returning just to make clear that we are taking no action. If you could just repeat the bill number for me, Madam Administrator.
There is no bill number. It was just a title that was raised on the 18th.
And the bill number? Okay, the item on which the committee will be taking no action is an act concerning the Department of Public Health's recommendations regarding clinical laboratories. This was item 12 from our 2/18 committee meeting agenda. Seeing no objections, the item we will take no action. Thank you, Madam Administrator.
Thank you, Beverly.
Thank you, Nick.
Have a good day.
Same to you. Bye.
Bye.